What are the key legislative milestones in APRN practice, and how have they shaped the current regulatory framework for nurse practitioners? Answer: Key legislative milestones include the establishment of the Nurse Practice Act, which sets the standards for nursing practice in each state, and the consensus model developed by the National Council of State Boards of Nursing (SEN). Important events include the Nurse Training Act of 1964, increased federal funding for nursing education and advanced practice roles, the APRN Consensus Model, 2008. This model standardizes the licensure, accreditation, certification, and education of APRNs across the United States, promoting uniformity and recognition of APRN roles. State-level legislation. Many states have enacted laws granting full practice status to nurse practitioners, allowing them to evaluate, diagnose, interpret diagnostic tests, and initiate treatment plans independently. These milestones have helped define the scope of practice, improve patient access to care, and ensure the competency of applicants. Explain the role of mutations in the pathogenesis of cancer. What are the two main types of mutations that can lead to tumor development? Answer: Mutations play a crucial role in the pathogenesis of cancer, primarily through the alteration of genes that control cell growth and division. The two main types of mutations are oncogene activation. Mutations in proto-oncogenes lead to their conversion into oncogenes, which can cause uncontrolled cell proliferation. For example, mutations in the RAS gene can result in persistent signaling for cell division, leading to tumor formation. Tumor suppressor gene inactivation. Mutations that deactivate tumor suppressor genes, such as TP, result in the loss of normal growth regulation. When these genes fail to perform their protective functions, the risk of cancer development increases significantly. Understanding the distinction between these mutations is vital for developing targeted therapies and interventions aimed at specific genetic abnormalities in cancer cells. A patient presents with persistent hypertension and signs of left ventricular hypertrophy on ECG. Discuss the potential long-term complications of untreated hypertension and the pathophysiological mechanisms involved. Answer: Untreated hypertension can lead to several long-term complications, including heart failure. Chronic pressure overload leads to left ventricular hypertrophy (LVH). The thickened myocardium becomes less compliant, resulting in diastolic dysfunction and eventually heart failure. Coronary artery disease (CAD). Hypertension accelerates atherosclerosis through endothelial injury, increased wall stress, and vascular remodeling, leading to reduced blood flow and potential myocardial infarction. Chronic kidney disease (CKD). Increased renal perfusion pressure damages the glomeruli over time, leading to nephrosclerosis and impaired renal function. Stroke. Hypertension is a significant risk factor for both ischemic and hemorrhagic strokes due to increased vascular resistance and weakened vessel integrity. Management of hypertension through lifestyle modifications and pharmacological interventions is crucial to prevent these complications. MS Thompson, a 45-year-old female, presents with fatigue, weight gain, and cold intolerance. Upon examination, she has a goiter and elevated TSH levels. What is the most likely diagnosis, and what is the underlying pathophysiological mechanism? Answer: The most likely diagnosis is hypothyroidism, specifically Hashimoto's thyroiditis, an autoimmune disorder. The underlying pathophysiological mechanism involves autoimmune destruction. In Hashimoto's, the immune system produces antibodies against thyroid peroxidase E and thyroglobulin, leading to the gradual destruction of thyroid follicular cells (TSH feedback loop). The destruction of thyroid tissue results in decreased production of thyroid hormones T and T, leading to elevated TSH levels as the pituitary gland attempts to stimulate the thyroid. Diagnosis can be confirmed with laboratory tests measuring thyroid hormone levels in the presence of specific antibodies. Treatment typically involves lifelong thyroid hormone replacement therapy. Describe the steps involved in the inflammatory response to tissue injury. What roles do cytokines and chemokines play in this process? Answer: The inflammatory response consists of several key steps. Recognition of injury. Tissue injury or infection triggers the release of damage-associated molecular patterns, DAMPs, and pathogen-associated molecular patterns, PAMPs, that activate immune cells, vasodilation, and increased permeability. Pro-inflammatory cytokines such as TNF-alpha and IL-1 cause vasodilation and increase vascular permeability, leading to redness and swelling. Cellular recruitment. Chemokines are released, attracting leukocytes G neutrophils and macrophages to the site of injury. These cells help contain and eliminate pathogens and clear debris. Resolution of inflammation. Anti-inflammatory cytokines (e.g., IL-10 and lipid mediators Lipixins promote the resolution of inflammation and tissue repair. Understanding these processes is crucial for managing inflammatory conditions and implementing therapies that can modulate the immune response. Discuss the pathophysiology of inflammatory bowel disease and differentiate between Crohn's disease and ulcerative colitis in terms of their anatomical and histological features. Answer: IBD encompasses two primary disorders: Crohn's disease and ulcerative colitis, characterized by chronic inflammation of the gastrointestinal tract. Crohn's disease anatomy can affect any part of the gastrointestinal tract, often presenting as skip lesions. Histology: transmural inflammation can lead to complications such as fistulas, strictures, and granuloma formation. Ulcerative colitis anatomy confined to the colon and rectum, typically involving a continuous segment. Histology: characterized by mucosal inflammation with crypt abscesses, but lacks transmural involvement in granulomas. Both conditions involve dysregulation of the immune response to intestinal microbiota, but their clinical management and surgical considerations differ due to their distinct pathophysiological features. What are the key differences in the pathophysiology and clinical presentation of iron deficiency anemia and megaloblastic anemia? Answer: the two types of anemia differ fundamentally in their causes and clinical manifestations. Iron deficiency anemia pathophysiology results from inadequate iron levels, leading to decreased hemoglobin synthesis. Common causes include dietary deficiency, chronic blood loss, and malabsorption. Clinical presentation: patients may present with fatigue, pallor, and pica. Blood tests reveal microcytic, hypochromic red blood cells and low serum ferritin levels. Megaloblastic anemia pathophysiology primarily caused by vitamin B or folate deficiency, leading to impaired DNA synthesis and resultant ineffective erythropoiesis. Clinical presentation: symptoms include fatigue, gositis, and neurological changes in B deficiency. Laboratory findings show macrocytic anemia and hypersegmented neutrophils. Describe the mechanism of acute tubular necrosis (ATN) and the factors that can contribute to its development. Answer: ATN is characterized by the injury and death of renal tubular epithelial cells, often resulting from ischemia or nephrotic cystity. The key mechanisms include ischemia, reduced blood flow, e.g., due to hypotension or sepsis, leads to decreased oxygen and nutrient delivery, causing cellular injury and apoptosis. Nephrotoxic agents: certain drugs, e.g., aminoglycosides, contrast media, can directly damage tubular cells, leading to cell death and loss of function. Inflammation and cytokine release: in response to injury, inflammatory mediators exacerbate damage and contribute to a cycle of further necrosis. ATN is often reversible if the underlying cause is addressed promptly. However, persistent injury can lead to chronic kidney disease. Compare and contrast the clinical features and pathophysiological mechanisms of Parkinson's disease and multiple sclerosis (MS). Answer: Parkinson's disease and MS are both neurological disorders, but differ in their clinical presentations and underlying mechanisms. Parkinson's disease clinical features: characterized by bradykinesia, rigidity, tremors, and postural instability due to dopamine deficiency resulting from degeneration of the substantia nigra. Pathophysiology: the loss of dopaminergic neurons leads to an imbalance between excitatory and inhibitory signals in the basal ganglia, affecting motor control. Multiple sclerosis clinical features: presence with a range of neurological symptoms, e.g., visual disturbances, motor weakness, sensory changes due to demyelination of central nervous system axons. Pathophysiology: an autoimmune process targets myelin sheaths, leading to inflammatory lesions and disruption of nerve impulse transmission. Understanding these differences is essential for diagnosis and treatment strategies, including the use of dopaminergic agents in Parkinson's and immunomodulatory therapies in MS. Discuss the immunological mechanisms underlying systemic lupus erythematosus (SLE) and the common clinical manifestations associated with the disease. Answer: SLE is a systemic autoimmune disorder characterized by the production of autoantibodies against nuclear and cytoplasmic antigens, leading to immune complex formation and tissue damage. The immunological mechanisms include loss of tolerance. Breakdown of self-tolerance in B and T cells leads to autoantibody production, particularly against double-stranded DNA and Smith antigens. Immune complex deposition. Immune complexes deposit in various tissues, activating complement and promoting inflammation, resulting in tissue damage. Common clinical manifestations include dermatological, malar rash, discoid lupus musculoskeletal, arthritis, arthralgia renal, Lupus nephritis characterized by hematuria and proteinuria, hematological anemia, leukopenia, thrombocytopenia. Understanding these mechanisms assists in the management of SLE, including the use of immunosuppressive therapies to control flares. Explain the principles of pharmacokinetics and pharmacodynamics and how they impact drug therapy in patients. Answer. Pharmacokinetics refers to the absorption, distribution, metabolism, and excretion of drugs. Understanding these principles helps determine the correct dosing and timing for medications to achieve therapeutic levels without toxicity. Absorption, the process of drug entry into the bloodstream. Factors such as route of administration, oral, rumen, and gastrointestinal pH can affect this. Distribution, the dispersion of drugs throughout the body fluids and tissues. Volume of distribution and protein binding influence how drugs reach their site of action. And metabolism, the biochemical transformation of drugs, primarily in the liver, which can activate or inactivate drugs. Cytochrome P enzymes play a significant role here. Excretion, the elimination of drugs from the body, mainly through the kidneys. Renal function significantly impacts drug clearance. Pharmacodynamics involves the study of how drugs exert their effects on the body. It includes receptor interactions, dose-response relationships, and therapeutic indices. Mechanism of action. Understanding how a drug works helps tailor therapy to specific conditions, e.g., agonists versus antagonists. Therapeutic window. The range between effective and toxic doses informs dosing strategies to maximize efficacy while minimizing side effects. Both pharmacokinetics and pharmacodynamics are essential for optimizing drug therapy, minimizing adverse effects, and ensuring patient safety. Discuss the ethical decision-making frameworks that can guide AP-INS in complex clinical cases. What are the key components of these frameworks? Answer. Ethical decision-making frameworks are essential for a PRNS when faced with complex clinical situations. Key components include autonomy, respecting patients' rights to make their own decisions about their healthcare; beneficence, acting in the best interest of the patient, promoting their well-being; non-maleficence, avoiding harm to patients, balancing risks and benefits of interventions; justice, ensuring fairness in the distribution of healthcare resources and treatment options. One common framework is the four principles approach, which helps APRNS systematically analyze cases by applying these ethical principles. Additionally, case-based discussions and interdisciplinary team approaches can provide valuable insights into ethical dilemmas, enhancing decision-making and patient outcomes. What legal implications arise from the distinction between independent and collaborative practice for APANS? Answer. The legal implications of independent versus collaborative practice are significant in the context of scope of practice and liability. Independent practice, in states that grant full practice authority, AP-INS can practice independently without physician oversight. This necessitates a comprehensive understanding of state regulations and potential liabilities for malpractice, as they assume full responsibility for patient care. Collaborative practice, in states requiring a supervisory or collaborative agreement with a physician, AP-INS must adhere to the terms of these agreements. This can restrict their ability to act autonomously and may expose them to legal issues if there is a failure to collaborate effectively. Understanding these implications is vital to ensure compliance with state laws and to protect against potential legal repercussions. MS Rodriguez, a 45-year-old patient with a history of hypertension, visits her nurse practitioner for a routine checkup. During the visit, she discloses her concerns about a recent episode of chest pain and asks whether she should undergo additional testing. What considerations should the nurse practitioner weigh in making the decision to recommend further diagnostic evaluation? Answer. In deciding whether to recommend further diagnostic evaluation, the nurse practitioner should consider clinical guidelines. Reference appropriate clinical guidelines for patients with chest pain, which may indicate the need for tests like an ECG or stress test based on risk factors, e.g., age, family history, informed consent. The nurse practitioner must ensure that MS Rodriguez understands the purpose of the test's potential risks and benefits, allowing her to make an informed choice about her care. Legal and ethical considerations. The nurse should also consider legal implications related to the scope of practice and documentation of the patient's symptoms and decision-making process. Patient-centered care. Assessing MS Rodriguez's values, preferences, and anxiety related to her symptoms is critical for shared decision-making. By addressing these considerations, the nurse practitioner can provide thorough and responsible care while adhering to legal and ethical standards. Explain the role of the National Council of State Boards of Nursing (SEN) in shaping APRN practice and licensure. What are the implications of the Nurse Licensure Compact (NLC) for APANS? Answer. The NCSBN plays a critical role in developing policies and guidelines that govern APRN practice and licensure through initiatives like the APRN Consensus Model. This model sets forth recommendations for education, certification, and regulation of APRNs, promoting uniformity across states. The Nurse Licensure Compact (NLC) allows a PRNS to practice in multiple participating states with a single license. This compact facilitates interstate practice and improves access to care, particularly in underserved areas. Implications include increased mobility. APRNS can provide care in multiple states without the need for additional licensure. Telehealth expansion. With the NLC, APRNS can offer telehealth services across state lines, improving patient access to healthcare. Regulatory challenges. APRNS must still adhere to the practice laws of the states in which they provide care, necessitating a thorough understanding of varying regulations. What is the significance of the emergence of nurse practitioners, (NPS), in the context of the evolving healthcare landscape? Answer: the emergence of nurse practitioners, (NPS), is significant due to several factors. Addressing healthcare shortages. NPS play a vital role in filling gaps in primary care, particularly in underserved areas, contributing to better access to healthcare services. Comprehensive care. NPS provide holistic care, often focusing on prevention and education, leading to improved patient outcomes and reduced healthcare costs. Legislative advances. As a result of advocacy efforts, many states have moved toward granting full practice authority to NPS, empowering them to operate independently and reducing reliance on physicians. Quality of care. Research has shown that NPS deliver care that is comparable in quality to that provided by physicians, fostering greater acceptance of their roles within the healthcare system. These factors underscore the importance of NPS in modern healthcare delivery and highlight the evolving scope of nursing practice. Discuss the role of a PRNS in health policy development. How can a PRNS influence legislative change in their practice environment? Answer: APRN involvement in health policy development is crucial for shaping the future of healthcare. They can influence legislative change through advocacy. APRNS can advocate for policies that enhance patient access to care, support full practice authority, and address healthcare disparities through grassroots campaigns, lobbying efforts, and professional organizations. Evidence-based research. By engaging in research and providing data on the efficacy of APRN-led interventions, APRNS can present compelling evidence to policymakers regarding the value of their roles. Collaboration. Partnering with other healthcare professionals and stakeholders can amplify their voice in policy discussions and create a unified front for legislative change. Continuing education. By participating in policy forums and educational programs, APRNS can stay informed about relevant legislative issues and contribute their expertise to policy formation. Through these activities, APRNS can play a significant role in shaping health policy to improve patient care and advance the nursing profession. Explain the concept of delegation of tasks within the scope of APRN practice. What are the legal considerations that APRN must keep in mind when delegating tasks? Answer: delegation in a PRN practice involves transferring responsibility for specific tasks to other healthcare personnel while retaining accountability for patient outcomes. Legal considerations include scope of practice. A PRNS must ensure that delegated tasks fall within the scope of practice as defined by state laws and regulations. Delegating tasks outside their legal authority can lead to liability issues. Competence of the delegate. APRNS must assess the qualifications and competencies of the individuals to whom they delegate tasks. Inadequate delegation can lead to patient harm and legal repercussions. Supervision and oversight. Even when tasks are delegated, APRNS retain responsibility for ensuring proper supervision and oversight of the delegated tasks, which is critical to maintaining patient safety. Documentation. Accurate documentation of delegation decisions, including the rationale and any relevant communication, is essential to defend against potential legal claims. Understanding these considerations is vital for a PRNS to navigate delegation safely and effectively. What are the implications of informed consent for a PRNS in their practice, particularly in situations involving advanced procedures or treatments? Answer: informed consent is a foundational principle in healthcare, requiring a PRNS to ensure that patients understand the nature of proposed treatments or procedures, including potential risks and benefits. Implications include legal responsibility. A PRNS are legally required to obtain informed consent before initiating treatment. Failure to do so may result in legal action for battery or negligence. Patient education. Effective informed consent involves thorough patient education, allowing them to make autonomous decisions regarding their care. This requires AP or NS to communicate complex medical information clearly and understandably. Documentation. Proper documentation of the informed consent process is critical. APR-NS must document that they provided information, answered questions, and confirmed that the patient understood the consent before proceeding. Special considerations. In cases of advanced procedures or treatments, APR-NS must be particularly vigilant in assessing the patient's capacity to consent and ensuring that consent is obtained from authorized representatives when necessary. Understanding these implications is essential for APR-NS to navigate informed consent effectively within their practice. Analyze the impact of evolving nursing theories on advanced practice nursing roles. How do these theories shape the delivery of care? Answer: evolving nursing theories significantly impact advanced practice nursing roles by providing frameworks that guide clinical practice education and research. Key points include holistic care. Theoretical frameworks, such as Gene Watson's theory of human caring, emphasized holistic approaches to patient care influencing APR-NS to address emotional, spiritual, and social needs alongside physical health. Evidence-based practice. The integration of nursing theories with evidence-based practice encourages APR-NS to implement interventions grounded in solid research, enhancing the quality and effectiveness of care. Patient-centered approaches. Theories focusing on patient engagement and empowerment, such as Orum's self-care theory, encourage APR-NS to foster patient autonomy and promote self-management, leading to better health outcomes. Guiding education. Nursing theories provide a foundation for APR-N education, shaping curricula and competencies needed to prepare APR-NS for complex clinical environments. By integrating nursing theories into their practice, APR-NS can enhance the quality of care provided to patients while fostering professional development and growth. Describe the impact of genetic polymorphisms on drug metabolism, particularly focusing on CYP enzyme variants. How can understanding these variations influence prescribing practices in advanced practice nursing? Answer: genetic polymorphisms refer to variations in DNA sequences that can affect individual responses to drugs, especially those metabolized by cytochrome P CYP enzymes. These enzymes are crucial for the metabolism of many medications. Variants such as CYP and CYP can lead to different phenotypes, classified as poor, intermediate, extensive, or ultra-rapid metabolizers. For instance, an ultra-rapid metabolizer of CYP may process antidepressants like fluoxetine more quickly, potentially leading to subtherapeutic levels. Conversely, a poor metabolizer may accumulate drugs, increasing the risk of adverse effects. Understanding these genetic differences allows advanced practice nurses to tailor pharmacotherapy, optimizing drug selection and dosing. This aligns with the principles of personalized medicine, ensuring patients receive the most effective and safe treatments. Mr. Johnson, a 72-year-old male, has been prescribed multiple medications, including a statin, an antihypertensive, and a benzodiazepine. What should Mr. Johnson consider regarding polypharmacy, and what strategies can his healthcare provider implement to mitigate risks? Answer: polypharmacy is defined as the concurrent use of multiple medications, which can increase the risk of adverse drug events, drug-drug interactions, and medication non-adherence. For Mr. Johnson, the combination of a statin, antihypertensive, and benzodiazepine raises concerns due to potential interactions and cumulative side effects, especially in older adults. His healthcare provider should conduct a thorough medication review to assess the necessity of each medication. Utilize the Beers criteria to identify potentially inappropriate medications for elderly patients. Implement a gradual tapering strategy for the benzodiazepine, if indicated, to minimize withdrawal symptoms. Educate Mr. Johnson on the importance of medication adherence and monitoring for side effects. Regular follow-ups should be scheduled to reassess his medication regimen, ensuring it remains appropriate and effective. Explain the therapeutic mechanisms of action for commonly prescribed cardiovascular drugs, including antihypertensives and lipid-lowering agents. Answer: cardiovascular drugs can be categorized based on their mechanisms of action. Antihypertensives. These medications reduce blood pressure through various pathways. ACE inhibitors, e.g. lisinopril, inhibit angiotensin-converting enzyme, reducing angiotensin I production, leading to vasodilation and decreased blood volume. Beta blockers, e.g. metoprolol, block beta-adrenergic receptors, decreasing heart rate and contractility, reducing cardiac output. Calcium channel blockers, e.g. amlodipine, prevent calcium entry into vascular smooth muscle, resulting in vasodilation. Lipid-lowering agents, statins, G. Atorvastatin inhibit HMD-CoA reductase, reducing cholesterol synthesis in the liver and increasing LDL receptor expression, leading to decreased LDL cholesterol levels. Fibrate C. G. Fenofibrate activate peroxis and proliferate or activated receptors, PPARs, enhancing the clearance of triglycerides and increasing HDL cholesterol. Discuss the significance of addressing drug-drug interactions in a patient receiving multiple medications. What guidelines can advanced practice nurses follow to minimize these interactions? Answer: drug-drug interactions can lead to increased toxicity or decreased therapeutic efficacy, significantly impacting patient safety. Advanced practice nurses must be vigilant, especially in polypharmacy scenarios. To minimize interactions, nurses can use comprehensive medication management systems that flag potential interactions, educate patients about the importance of reporting all medications, including over-the-counter drugs and supplements, review drug interaction databases, e.g. Lexicomp or Micromodex when prescribing new medications, adjust dosages or select alternative therapies when potential interactions are identified. By following these guidelines, advanced practice nurses can enhance patient safety and ensure effective therapeutic outcomes. Analyze the pharmacokinetic considerations in pediatric patients regarding weight-based dosing. Why is this approach critical in this population? Answer: pediatric patients exhibit significant physiological differences compared to adults, necessitating weight-based dosing to ensure safe and effective pharmacotherapy. Key pharmacokinetic considerations include absorption, gastrointestinal pH, gastric emptying time, and enzyme activity differ in children, influencing drug absorption. Distribution. Body composition varies with age. Neonates have a higher percentage of body water and lower fat, affecting the volume of distribution for hydrophilic and lipophilic drugs. Metabolism. Liver enzyme activity can be immature in infants, impacting drug metabolism. Age-specific metabolic pathways must be considered. Excretion. Renal function matures over the first year of life, and dosing adjustments based on creatinine clearance are often necessary. Weight-based dosing (e.g.) allows for individualized medication administration, accounting for these variations and reducing the risk of underdosing or overdosing. Explain the principles of safe prescribing practices for controlled substances, particularly focusing on opioids and benzodiazepines. Answer: safe prescribing of controlled substances, especially opioids and benzodiazepines, involves several key principles. Risk assessment: evaluate patient history for substance use disorders, previous addiction issues, and current medications to identify high-risk individuals. Informed consent: discuss potential benefits and risks with patients before initiating therapy, ensuring they understand the treatment plan. Monitoring: implement regular follow-ups to assess efficacy, side effects, and signs of misuse. Utilize prescription drug monitoring program (EDPS) to track prescriptions, tapering, and discontinuation. For patients requiring long-term therapy, develop a tapering plan to minimize withdrawal symptoms and prevent dependency. Adhering to these principles aligns with guidelines from the Centers for Disease Control and Prevention (CDC) and the American Pain Society, promoting patient safety and responsible prescribing. Mr. Smith, a 60-year-old man with type 2 diabetes, is starting a new medication regimen that includes insulin and an oral hypoglycemic agent. What considerations should his healthcare provider take into account to ensure safe and effective management of his condition? Answer: for Mr. Smith, several considerations must be addressed to ensure safe management of his diabetes, with both insulin and oral hypoglycemic agents. Monitoring blood glucose. Regular monitoring is essential to prevent hypoglycemia, particularly when initiating insulin therapy. Educate Mr. Smith on recognizing signs of low blood sugar. Dosing adjustments. Ensure appropriate dosing based on current blood glucose levels, dietary intake, and physical activity. Adjustments may be necessary for changes in lifestyle or weight. Education on self-management. Provide education on insulin administration techniques, dietary recommendations, and the importance of maintaining a balanced diet. Drug interactions. Assess potential interactions with other medications Mr. Smith is taking, particularly those that can affect glucose levels, e.g. corticosteroids. Regular follow-ups. Schedule routine follow-ups to evaluate the effectiveness of the treatment plan and make necessary adjustments. By considering these factors, a healthcare provider can enhance Mr. Smith's diabetes management and reduce the risk of complications. Describe the role of non-pharmacological therapies in advanced practice nursing. How can integrating these therapies improve patient outcomes? Answer: non-pharmacological therapies play a vital role in holistic patient care, particularly in managing chronic conditions. Their integration can lead to improved outcomes by reducing medication burden, Utilizing therapies such as acupuncture, yoga, or nutritional interventions can decrease reliance on medications, reducing the risk of side effects and interactions. Enhancing quality of life, complementary therapies often address physical, emotional, and spiritual health, leading to a more comprehensive approach to patient well-being. Improving patient engagement, encouraging patients to participate in their care through lifestyle modifications can enhance adherence to treatment plans and foster a sense of empowerment. Addressing symptoms, non-pharmacological approaches can effectively manage symptoms of conditions like chronic pain or anxiety, potentially enhancing overall treatment efficacy. Advanced practice nurses should assess the appropriateness of integrating these therapies into patient care, considering individual preferences and clinical evidence supporting their use. Discuss the importance of understanding the FDA pregnancy categories when prescribing medications to pregnant patients. What considerations should advanced practice nurses take into account? Answer: the FDA pregnancy categories classify medications based on their safety during pregnancy, influencing prescribing decisions. Category A. Controlled studies show no risk to the fetus in the first trimester. These drugs are typically safe for use. Category B. Animal studies show no risk, but human studies are lacking. These may be prescribed if benefits outweigh potential risks. Category C. Animal studies indicate risks, but benefits may warrant use despite potential risks. Caution is essential when prescribing. Category D. Evidence of risk exists, but the benefits may outweigh risks in life-threatening situations. Category X. Studies demonstrate fetal abnormalities. These drugs are contraindicated in pregnancy. Advanced practice nurses must thoroughly assess the risks and benefits of prescribing any medication to pregnant patients, considering alternative therapies, dosage adjustments, and monitoring for adverse effects. Collaboration with obstetricians may be warranted for complex cases. Explain the significance of evidence-based practice in advanced practice nursing. How can advanced practice nurses incorporate BP into their clinical decision-making? Answer: evidence-based practice is essential in advanced practice nursing as it integrates the best available research with clinical expertise and patient preferences, leading to improved patient outcomes. To incorporate BP into clinical decision-making, advanced practice nurses can stay informed, engage in continuous education and professional development to keep up with the latest research findings and guidelines, utilize BP frameworks, implement frameworks such as the PICO Population Intervention Comparison Outcome Model to structure clinical questions and guide literature searches. Engage in collaborative practice. Work with interdisciplinary teams to share insights and research findings, enhancing the quality of care. Involve patients. Include patient preferences and values in the decision-making process, ensuring care is tailored to individual needs. Evaluate outcomes. Regularly assess clinical outcomes and patient feedback to refine practices and improve care delivery.